Hey everyone, and welcome back to our channel. Today, we're talking about something incredibly important for anyone over 60, or for those who care for someone in that age group. As we gracefully age, our bodies send us signals. Some are just part of the normal journey, but others can be whispers of a more serious issue. Ignoring these whispers can sometimes lead to a shout in the form of a medical emergency. So let's tune into our bodies and learn about 6 dangerous symptoms that you should never ignore. Staying informed is staying empowered, and it's a crucial step in safeguarding your health for years to come. First up is sudden unexplained weight loss. You might think, great, I'm losing weight without even trying. But hold on. While intentional weight loss through diet and exercise is fantastic, losing more than 5% of your body weight in 6 to 12 months without a reason is a major red flag. What could it be telling you? This could be a sign of several underlying conditions, such as an overactive thyroid, diabetes, liver disease, or even cancer. Your body uses a lot of energy to fight off these illnesses, which can cause you to shed pounds unexpectedly. It's not a victory, it's a warning. If the numbers on the scale are dropping and you don't know why, it's time to book an appointment with your doctor for a thorough checkup. Don't just celebrate the weight loss, investigate it. The second symptom to watch for is persistent shortness of breath. We all get a little winded climbing a steep hill or rushing to catch a bus. But what if you're getting breathless from simple activities that used to be easy, like walking to the mailbox or making the bed? Or worse, what if it happens when you're just sitting still? This isn't just a sign of getting older or being out of shape. It could be your heart or lungs crying out for help. Conditions like chronic obstructive pulmonary disease, better known as COPD, asthma, or even heart failure can manifest this way. Your body isn't getting the oxygen it needs to function properly, so if you find yourself gasping for air more often, don't just brush it off. It's a critical signal that needs immediate medical attention. Let's move on to number 3. Sudden confusion or personality changes. This one can be really unsettling, both for the person experiencing it and for their loved ones. If you or someone you know suddenly struggles to think clearly, has trouble focusing, or experiences abrupt shifts in behavior, like going from calm to extremely agitated for no apparent reason, it's a serious concern. These aren't just senior moments. Sudden confusion can be a symptom of a urinary tract infection, which can present very differently in older adults. It could also signal a stroke, a brain tumor, or severe dehydration. It's crucial to act fast. If you notice these changes, seek medical help right away. Early diagnosis can make all the difference in treatment and recovery. The fourth dangerous symptom is changes in your bowel habits. It might be an uncomfortable topic, but it's an essential one. Our digestive system is a pretty good indicator of our overall health. If you notice persistent changes, like chronic constipation, diarrhea that lasts for days, black or tarry stools, or rectal bleeding, your body is sending a clear signal. These symptoms could be related to anything from an infection or irritable bowel syndrome to more serious issues like inflammatory bowel disease or colorectal cancer. The key here is the word persistent. An off day is normal, but a pattern of change is not. Don't be embarrassed to discuss this with your doctor. It's a conversation that could save your life. Coming in at number 5 is a loss of balance and coordination, or sudden dizziness. We've all had a moment of feeling a bit wobbly, but if you're frequently feeling unsteady on your feet, experiencing vertigo, or having episodes of dizziness, it's a cause for concern. These symptoms significantly increase the risk of falling, which can lead to fractures and other serious injuries that are much harder to recover from as we age. But what's causing it? It could be something simple like an inner ear issue, or it could be a sign of something more serious, like a stroke, a neurological disorder like Parkinson's disease, or even a problem with your vision or blood pressure. Don't just accept falling as an inevitable part of aging. Get it checked out to identify the root cause and find ways to stay steady and safe. Finally, our 6th symptom is the sudden onset of a severe headache, often described as the worst headache of your life. We all get headaches, but this is different. This isn't your typical tension headache or migraine. A sudden, explosive headache can be a sign of a brain aneurysm or a stroke, both of which are life-threatening emergencies. Similarly, if a headache is accompanied by a stiff neck, fever, confusion, or vision changes, it could indicate meningitis or another serious condition. In these situations, time is absolutely critical. Do not wait it out. Do not take a painkiller and hope it goes away. Call for emergency medical help immediately. This is one symptom where every second counts. So to recap, our 6 dangerous symptoms are unexplained weight loss, shortness of breath, sudden confusion, changes in bowel habits, loss of balance, and a sudden severe headache. The common thread here is paying attention to sudden or persistent changes in your body. Your body is an incredible communicator, and learning its language is one of the most proactive things you can do for your health after 60. Don't dismiss these signs as just getting old. They are your body's early warning system. Please remember, this video is for informational purposes and is not a substitute for professional medical advice. Always consult your doctor with any health concerns. Your health is your greatest asset, so let's work together to protect it. Think about it this way. Your body is an incredibly smart machine. When it has trouble breathing, it's sending you a direct message that something isn't right. This isn't just about feeling a little tired. We're talking about a feeling of air hunger, where you can't seem to get enough oxygen no matter how deeply you breathe. This sensation, especially when it happens with minimal exertion or even when you're resting, is a sign that your heart or lungs are struggling. What could be causing it? The possibilities are serious. One major concern is heart failure. This doesn't mean your heart has stopped working, but rather that it isn't pumping blood as efficiently as it should. When this happens, fluid can back up into the lungs, making it difficult to breathe. You might also notice swelling in your ankles or legs, or feel more tired than usual. Shortness of breath, especially when you lie down, is a classic sign of this condition. Another potential culprit is chronic obstructive pulmonary disease, or COPD. This is a group of lung diseases, including emphysema and chronic bronchitis, that block airflow and make breathing difficult. While often linked to a history of smoking, it can affect non-smokers as well. The breathlessness from COPD tends to develop gradually, but any sudden worsening is a cause for immediate concern. We also have to consider the possibility of a pulmonary embolism. This is a blood clot that travels to the lungs, blocking an artery. It's a medical emergency that can be life-threatening. The shortness of breath is usually sudden and sharp, and it might be accompanied by chest pain. If you experience these symptoms together, it is critical to seek emergency medical help without delay. Other lung problems like pneumonia or even asthma that develops later in life can also present with shortness of breath. Even anemia, a condition where you don't have enough healthy red blood cells to carry adequate oxygen to your body's tissues, can leave you feeling constantly winded. The point is, the list of potential causes is long and includes many conditions that require prompt medical treatment. So what should you do? First, pay attention to your body. Don't dismiss this symptom. Keep a simple log. When does the breathlessness happen? What are you doing when it starts? Does anything make it better or worse? Does it come with other symptoms like chest tightness, coughing, or wheezing? This information will be incredibly valuable for your doctor. Next, and most importantly, make an appointment to see your healthcare provider. Be direct and clear. Say, I am experiencing shortness of breath and it's worrying me. Describe your symptoms in detail using the notes you've taken. Your doctor will listen to your heart and lungs and will likely order some tests to figure out what's going on. This could include a chest X-ray, an electrocardiogram, or EKG, to check your heart's electrical activity, or blood tests. Ignoring unexplained shortness of breath is a gamble you don't want to take. It's not a sign of weakness to seek help. It's a sign of wisdom. It's about taking control of your health so you can continue to enjoy your life, your family, and your hobbies without being held back. Your body is trying to tell you something important. Please, listen to it. First on our list, and arguably one of the most concerning, is sudden or persistent chest pain. Now I know what many of you might be thinking. Oh, it's probably just heartburn from that spicy dinner. Or, I must have pulled a muscle while gardening. It's incredibly common for older adults to downplay chest discomfort, mistaking it for indigestion or a simple muscle strain. However, this is a symptom you absolutely cannot afford to ignore. It could be an early warning sign of serious heart disease, or even an impending heart attack. What's important to understand is that this pain doesn't always present as the dramatic, clutching the chest moment you see in movies. It can be much more subtle. You might feel a sense of pressure, as if something heavy is sitting on your chest. It could feel like a squeezing or a fullness. The discomfort might not even be confined to your chest. It can radiate to your shoulders, arms, neck, jaw, or back. If you notice this feeling happens frequently, especially when you're exerting yourself like climbing stairs or carrying groceries and it subsides when you rest, that's a classic sign of angina, which is chest pain caused by reduced blood flow to the heart. This is a major red flag. Don't wait to see if it goes away on its own. It's crucial to seek medical attention immediately to get a proper diagnosis and prevent a more severe cardiac event. The second dangerous symptom we need to talk about is sudden confusion or difficulty speaking. One moment you're having a normal conversation, and the next, you're struggling to find the right words, your speech is slurred, or you feel disoriented and confused about where you are. This can be terrifying, both for the person experiencing it and for those around them. Often, families might dismiss it as a senior moment or a sign of fatigue. But a sudden change in cognitive function is a medical emergency. It's one of the key indicators of a stroke, which happens when blood supply to part of the brain is interrupted. Another potential cause could be a severe infection, like a urinary tract infection, which can surprisingly manifest as confusion in older adults. Dehydration or a significant imbalance in your electrolytes can also be the culprit. The bottom line is, if you or a loved one suddenly can't speak clearly, can't understand what others are saying, or seems lost and confused, time is of the essence. Think of the acronym FAST, face drooping, arm weakness, speech difficulty. Time to call emergency services. Acting quickly can make a world of difference in the outcome and recovery from conditions like a stroke. Next up, number 3, unexplained and significant weight loss. Losing a few pounds after starting a new exercise routine or eating healthier is one thing, and that's great. But if you find the numbers on the scale dropping without any change in your diet or activity level, it's a cause for concern. Losing more than 5% of your body weight over a period of 6 to 12 months without trying is not a normal part of aging. It's a non-specific symptom, meaning it can be linked to a wide range of underlying health issues. This could be one of the first signs of an overactive thyroid, which speeds up your metabolism. It could also point to gastrointestinal problems that prevent your body from absorbing nutrients properly. More seriously, unexplained weight loss is a common symptom of various types of cancer. It can also be linked to depression, as mental health struggles can significantly impact appetite. Whatever the cause, your body is telling you that something is wrong. Don't just celebrate the weight loss. Schedule a visit with your doctor to investigate the root cause. They can run the necessary tests to figure out what's going on. Our fourth symptom is shortness of breath. Feeling a little winded after a strenuous workout is normal, but if you find yourself gasping for air after simple activities like walking to the mailbox, making your bed, or even while you're just sitting and resting, that's a major warning sign. This is known medically as dyspnea, and it should never be brushed aside. It's a classic symptom of several serious heart and lung conditions. For example, it could indicate congestive heart failure, where your heart isn't pumping blood as efficiently as it should, causing fluid to back up in your lungs. It could also be a sign of chronic obstructive pulmonary disease, or COPD, especially if you have a history of smoking. Another dangerous possibility is a pulmonary embolism, which is a blood clot in your lungs. This is a life-threatening emergency. If shortness of breath comes on suddenly and is severe, or if it's accompanied by chest pain or fainting, you need to call for emergency help immediately. Don't just assume you're out of shape. Your respiratory system is vital, and any difficulty with breathing requires immediate medical evaluation. Coming in at number 5 are changes in bowel or bladder habits. This is a topic people are often hesitant to discuss, even with their doctors, but it's incredibly important. If you notice persistent changes, it's something you need to address. What kind of changes are we talking about? This could mean ongoing constipation or diarrhea that isn't resolving, a feeling that your bowel doesn't empty completely, or seeing blood in your stool. Blood in your stool, whether it's bright red or makes the stool look black and tarry, is never normal and always warrants a trip to the doctor. These These symptoms can be indicators of conditions ranging from irritable bowel syndrome to more serious issues like colorectal cancer. Similarly, pay attention to your bladder. Are you needing to urinate much more frequently? Is there pain or burning during urination? Are you having trouble starting or stopping the flow? For men, this can be a sign of an enlarged prostate, but it can also signal bladder infections or even bladder cancer. For both men and women, these changes can disrupt your life and might be pointing to an underlying condition that needs treatment. It might feel embarrassing to talk about, but your doctor has heard it all before and is there to help, not to judge. Finally, our sixth dangerous symptom is the sudden onset of a severe headache, often described as the worst headache of your life. We all get headaches from time to time due to stress, lack of sleep, or dehydration. But a headache that is abrupt, excruciating, and unlike any you've ever experienced before, is a medical emergency. This type of headache, sometimes called a thunderclap headache, can be a sign of a brain aneurysm that has ruptured, which causes bleeding in the brain. This is a life-threatening situation that requires immediate intervention. If this severe headache is accompanied by other symptoms like a stiff neck, fever, confusion, seizures, or weakness on one side of your body, the urgency is even greater. These could also be signs of meningitis, which is an inflammation of the membranes surrounding your brain and spinal cord, or a stroke. The key takeaway here is the nature of the headache. If it's sudden and severe, don't just reach for a painkiller and hope it goes away. Call for emergency medical help right away. It's always better to be safe than sorry when it comes to your brain. So, to recap, the 6 symptoms we've covered are persistent chest pain, sudden confusion or trouble speaking, unexplained weight loss, shortness of breath, changes in bowel or bladder habits, and a sudden, severe headache. Your health is your most valuable asset, and being proactive is your best defense. Listening to your body and taking these warning signs seriously can truly be a matter of life and death. Don't ever feel like you're being a bother by seeking medical advice. Your doctor wants to hear from you. Early detection and treatment almost always lead to better outcomes. First up is something many people might initially welcome: sudden or unexplained dizziness and balance problems. You might stand up a little too fast and feel lightheaded, or maybe you notice you're not as steady on your feet as you used to be. It's tempting to brush this off as just a normal part of getting older, right? Oh, I just need to be more careful. But hold on. Frequent dizziness or a feeling of vertigo, that spinning sensation, can be a sign of several underlying issues. It could be something as simple as dehydration or an inner ear problem, but it can also signal more serious conditions like heart problems, low blood pressure, or even neurological disorders. If you find yourself grabbing onto furniture for support more often, or if you've had a near fall because you suddenly felt unsteady, that's not something to ignore. Your body's balance system is complex, and a disruption deserves attention. Don't wait for a fall to happen. Make a note of when these episodes occur and talk to your doctor about them. Next on our list, let's talk about shortness of breath. We're not talking about huffing and puffing after climbing 5 flights of stairs. We mean feeling breathless after activities that used to be easy, like walking to the mailbox, carrying groceries, or even just talking. You might find yourself pausing more often to catch your breath. This is a classic symptom that people often attribute to being out of shape or just, again, getting older. But it can be a serious red flag for heart or lung conditions. Issues like chronic obstructive pulmonary disease or COPD, asthma, or even heart failure can manifest this way. Your heart and lungs work together to deliver oxygen to your body, and when you're consistently short of breath, it means that system isn't working as efficiently as it should. Pay attention to whether it happens during activity, at rest, or if you wake up breathless at night. These details are vital clues for your doctor. Getting it checked out early can make a world of difference in managing any potential condition. The third symptom we need to discuss is persistent abdominal pain or changes in bowel habits. A little tummy ache now and then is normal for everyone, but if you're experiencing pain that doesn't go away, or if you notice significant lasting changes in your bathroom routine, like persistent diarrhea, constipation, or changes in the stool itself, it's time to take it seriously. We often dismiss digestive issues as something we ate, but chronic discomfort can be a sign of something more. It could indicate conditions like irritable bowel syndrome, diverticulitis, ulcers, or in some cases, it could be a warning sign for colorectal cancers. The key here is the word persistent. A one-off issue is one thing, but a pattern that lasts for weeks is your body telling you something isn't right inside. It can be an awkward topic to bring up, but your doctor has heard it all before. Being open and honest about these changes is crucial for your long-term health. Now for our fourth point, and it's a big one, unintentional weight loss. This is another one of those silent warnings that something might be wrong. Let's be clear. We're talking about losing a noticeable amount of weight without trying. You haven't changed your diet, you haven't started a new exercise regimen, but your clothes are getting looser and the number on the scale is dropping. Many people might secretly cheer, thinking it's a good thing. But especially after 60, significant unexplained weight loss should always be investigated. It can be linked to a variety of health issues. An overactive thyroid, for example, can speed up your metabolism and cause you to shed pounds. Undiagnosed diabetes can also lead to weight loss. In more serious cases, it can be one of the first signs of cancer, as the body uses up more energy to fight the disease. So if you've lost more than 5% of your body weight over a period of 6 to 12 months without a clear reason, please make an appointment with your healthcare provider. It's a symptom that's too important to ignore. Moving on to our fifth dangerous symptom, changes in memory and thinking that interfere with daily life. Let's make a distinction here. Forgetting where you put your keys or the name of an actor is a normal part of life. But we're talking about memory problems that are more severe. This could be asking the same questions over and over, getting lost in familiar places, having trouble following a recipe you've made 100 times, or struggling to manage your finances. These are not typical age-related changes. When cognitive shifts start to impact your ability to function independently and safely, it could be a sign of mild cognitive impairment or the early stages of dementia, such as Alzheimer's disease. It can also be caused by other treatable conditions, like vitamin deficiencies, thyroid problems, or even a reaction to medication. The most important thing is not to hide it or feel ashamed. Early diagnosis allows you and your family to access support, resources, and treatments that can help manage symptoms and improve your quality of life. Speaking up is a sign of strength. Finally, our sixth symptom is the sudden onset of a severe headache or vision changes. A headache is a headache, right? Not always. If you suddenly experience the worst headache of your life, a headache that feels like a thunderclap, or one that's accompanied by a stiff neck, fever, or confusion, this is a medical emergency. It could be a sign of a stroke, a brain aneurysm, or meningitis. Similarly, any sudden vision changes, like blurred vision, double vision, seeing flashing lights, or a sudden loss of sight in one eye, should not be put on the back burner. These can be symptoms of a stroke, a detached retina, or acute glaucoma. With these conditions, time is absolutely critical. The faster you get medical help, the better the chances of a good outcome and preventing long-term damage. Don't try to sleep it off or wait to see if it gets better. Call for emergency help immediately. It's always better to be safe than sorry. So to recap, we've covered 6 critical symptoms: dizziness and balance issues, shortness of breath, persistent abdominal pain, unintentional weight loss, significant memory changes, and sudden severe headaches or vision problems. The common thread here is that these are all changes from your personal baseline. What, yes, normal for you. Getting older brings changes, but it shouldn't mean accepting symptoms that impact your quality of life or signal a serious problem. First on our list is a symptom that's incredibly common and often brushed aside: persistent fatigue. I'm not talking about feeling a little tired after a busy day or a poor night's sleep. We all experience that. I'm referring to a deep, draining exhaustion that sticks with you day after day, week after week, no matter how much you rest. You might find yourself too tired to do the things you once enjoyed, like gardening, walking the dog, or playing with your grandkids. This isn't just a normal part of aging. This kind of profound fatigue can be your body's alarm bell, signaling an underlying health problem. For example, it's a classic symptom of anemia, a condition where your body lacks enough healthy red blood cells to carry adequate oxygen to your tissues. This leaves you feeling weak and short of breath. Persistent fatigue can also be a red flag for heart disease. When the heart isn't pumping efficiently, your body diverts blood from less vital areas, like your limbs, to support the heart and brain. causing a pervasive sense of tiredness. Other potential causes include chronic infections, thyroid problems, or even depression. So if you're feeling constantly wiped out and rest doesn't seem to help, please don't ignore it. It's a clear sign that you need to schedule a visit with your doctor. A simple checkup and some blood tests can often uncover the root cause and get you on the path to feeling like yourself again. Catching these things early is absolutely key. The second dangerous symptom we need to talk about is unexplained weight loss. Now, many people might think losing a few pounds without trying is a good thing, but when you're over 60, it can be a serious warning sign. If you've lost more than 5% of your body weight over a period of 6 to 12 months, and you haven't been dieting or increasing your exercise, it's time to pay attention. For example, if you weigh 150 pounds, a 5% loss is about 7.5 pounds. It might not seem like a lot, but your body doesn't just shed weight for no reason. Unintentional weight loss can be one of the first signs of several significant health conditions. It's associated with various types of cancer, as cancer cells consume a lot of energy, leading to weight loss. It can also point to gastrointestinal disorders that prevent your body from absorbing nutrients properly, or an overactive thyroid, which speeds up your metabolism to an unhealthy degree. Even psychological conditions like depression can cause a loss of appetite and subsequent weight loss. The key here is the word unexplained. If your clothes are suddenly looser and the number on the scale is dropping without any change in your lifestyle, it's a signal from your body that something is amiss. Don't celebrate it, investigate it. A conversation with your doctor is the essential next step to figure out what's going on. Next up, let's discuss sudden changes in vision. It's true that our eyesight naturally changes as we get older. Many of us need reading glasses or find ourselves dealing with cataracts. But I'm not talking about the gradual blurriness that comes with age. I'm referring to sudden dramatic changes. This could be a sudden loss of vision in one eye, seeing flashes of light, a shower of floaters that look like spots or cobwebs, or a dark curtain coming down over your field of vision. These are not normal, and they require immediate medical attention. These symptoms can indicate a serious emergency. For instance, sudden flashes and floaters could be a sign of a retinal detachment, where the light-sensitive tissue at the back of your eye pulls away. If not treated quickly, this can lead to permanent vision loss. A sudden painless loss of vision could be caused by a blockage in an artery supplying blood to the eye, which is essentially a stroke in the eye, and can sometimes be a warning sign for a larger stroke in the brain. Other possibilities include glaucoma or macular degeneration, which can progress rapidly. The bottom line is this: your vision is precious. Any sudden, strange, or significant change is an emergency. Don't wait to see if it gets better. Go to an emergency room or an ophthalmologist right away. The fourth symptom on our list is persistent shortness of breath. We all get a little winded after climbing a flight of stairs or rushing to catch a bus. But if you find yourself getting breathless during activities that used to be easy, or even while you're at rest, that's a major red flag. Feeling like you can't get enough air is a frightening experience, and it's your body's way of telling you that it is struggling to get the oxygen it needs. Shortness of breath, medically known as dyspnea, can be a primary symptom of serious heart or lung problems. It could be a sign of congestive heart failure, where the heart can't pump blood effectively, causing fluid to back up into the lungs. It might also indicate chronic obstructive pulmonary disease, or COPD, a progressive lung disease that makes it hard to breathe. Other culprits could be a pulmonary embolism, which is a blood clot in the lung, or even pneumonia. Because the potential causes are so serious and life-threatening, shortness of breath should never be ignored. If it comes on suddenly or is severe, treat it as a medical emergency. If it's a new and persistent issue during your daily activities, make an appointment with your doctor as soon as possible. Number 5 is a change in bowel or bladder habits. This is a topic people are often hesitant to discuss, even with their doctors, but it's incredibly important. I'm talking about any noticeable, persistent change from your normal routine. This could mean ongoing constipation or diarrhea, a feeling that your bowel doesn't empty completely, or seeing blood in your stool. For bladder habits, it might be a new urgency, needing to go more frequently, pain during urination, or seeing blood in your urine. While occasional changes are normal, A pattern that lasts for more than a couple of weeks is not. These changes can be indicators of several conditions, ranging from infections to more serious diseases. Blood in the stool or urine, for example, is a classic warning sign for colon or bladder cancer. Persistent diarrhea or constipation could signal an inflammatory bowel disease or even a blockage. While it might be something as simple as a urinary tract infection or a change in diet, you can't know for sure without getting it checked out. It's far better to have a slightly awkward conversation with your doctor and find out it's nothing serious than to ignore a symptom that could be an early sign of a treatable but dangerous condition. Your doctor is a professional. They've heard it all before. Please don't let embarrassment stand in the way of your health. Finally, the sixth dangerous symptom is confusion or personality changes. This can be one of the most distressing symptoms, both for the person experiencing it and for their family. I'm referring to sudden bouts of confusion, disorientation, trouble with memory, or noticeable shifts in personality or behavior. For instance, a normally calm and gentle person might suddenly become agitated or irritable. They might have trouble recognizing familiar people or places, or struggle to follow a conversation. It is easy for family members to mistake this for a senior moment, or the beginning of dementia. But sudden changes are different and need urgent evaluation. While cognitive decline can be gradual with conditions like Alzheimer's, a sudden onset of confusion, known as delirium, often points to an underlying acute medical problem. One of the most common causes in older adults is a simple infection, like a urinary tract infection or pneumonia. The infection can throw the body systems out of balance, directly affecting brain function. Other causes can include dehydration, electrolyte imbalances, medication side effects, or even a silent stroke or brain tumor. Because the cause could be a treatable and reversible condition, it's critical to seek medical help immediately. If you or a loved one experiences a sudden change in mental state, don't wait. It's a medical emergency. So, there you have it. 6 critical symptoms that no one over 60 should ignore. Persistent fatigue, unexplained weight loss, sudden vision changes, shortness of breath, new bowel or bladder habits, and sudden confusion. Your body is an amazing communicator, and listening to its signals is one of the most powerful things you can do for your long-term health. First on our list is changes in memory or significant confusion. How many times have you heard someone say, "Oh, I'm just having a senior moment," when they forget a name or where they put their keys? While it's true that minor memory lapses can be a normal part of aging, we need to be careful not to brush off more serious cognitive changes. We're not talking about forgetting which day of the week it is and then remembering later. We're talking about consistent and disruptive changes that interfere with daily life. So, what should you really be looking out for? One major red flag is frequent confusion, especially about time or place. For example, losing track of seasons, years, or not recognizing a familiar location. Another is repeatedly misplacing important items, like putting your wallet in the refrigerator and having no memory of how it got there. This is different from simply misplacing your glasses and then retracing your steps to find them. Trouble with language is another critical sign. This could manifest as difficulty finding the right words, calling things by the wrong name, or stopping mid-sentence with no idea how to continue the conversation. It's more than just having a word on the tip of your tongue. It's a persistent struggle to communicate effectively. Similarly, if you or a loved one are having trouble with familiar tasks, like following a recipe you've made a dozen times or forgetting the rules of a favorite card game, that's a warning bell. These symptoms could point to mild cognitive impairment, or they might be the early signs of a more serious condition like Alzheimer's disease or another form of dementia. The reason it's so dangerous to ignore these signs is that early detection is absolutely key. When cognitive decline is caught early, there are so many more options available. Doctors can perform thorough evaluations to rule out other possible causes, like vitamin deficiencies, thyroid problems, or medication side effects, which can sometimes mimic dementia symptoms. If it is determined to be the beginning of a condition like Alzheimer's, an early diagnosis allows for access to treatments that can help manage symptoms and, in some cases, slow the progression of the disease. It also opens the door to crucial lifestyle adjustments. Things like a brain-healthy diet, regular physical exercise, and social engagement have been shown to have a positive impact on cognitive function and can help preserve independence for much longer. Furthermore, getting a diagnosis early gives the individual and their family time to plan for the future. This can involve making legal and financial arrangements, setting up a support system, and making decisions about long-term care while the person is still able to participate in those choices. It reduces stress and uncertainty down the road. So, please, if you notice these kinds of memory changes in yourself or someone you love, don't just dismiss it. Talk to a doctor. It's not about being paranoid. It's about being proactive with your health. It's the most empowering step you can take. Next up, let's discuss another symptom that often gets mistaken for something less serious: sudden or persistent shortness of breath. The video would continue with the next points. Thank you so much for watching. If you found this information helpful, please give this video a thumbs up and consider subscribing to the channel for more health content. Don't forget to hit that notification bell so you never miss an update. Stay safe and be proactive about your health.